Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Annia Raja. She's a clinical psychologist. Today's Kevin MD article is Why More Physicians Are Quietly Starting Therapy. Annia, welcome to the show.
Thank you so much for having me, Kevin.
All
Appreciate
right,
it.
let's start by briefly sharing your story and journey.
Yeah, so I'm a clinical psychologist in private practice, and I specialize in providing therapy to physicians. It's the long and short of it is my spouse is a physician. He and I have been together since pre-med. And when I went into private practice, both kind of organically as well as eventually me making it explicit in my practice, I eventually made an explicit specialty of working with physicians, providing in-depth therapy. And I am very passionate about serving this population and speaking about, intersections of physician mental health, wellness, doctor burnout, etc.
All right, and how long have your clientele primarily be physicians?
I would say it has been at least 5 years or so, really kind of starting right at the helm of COVID,
Hmm.
especially. So, and even before then, it was a bit of a kind of implicit kind of attraction that some physicians had gotten to my practice. And right around COVID, I just saw that there was a very clear need. And I just made that very explicit in my practice.
All right. Would love to hear more about your observations and insights. This is a clear topic that's on the minds and the forefront of many physicians. Your articles on Kevin MD is Why More Physicians Are Quietly Starting Therapy. For those who didn't get a chance to read your article, tell us what it's about.
Yeah, so really just kind of giving a, kind of a narrative from what I've seen from the vantage point of my practice of how, thankfully more and more physicians are reaching out to get
Mhm.
therapy, whether it's with, reaching out to me or other clinicians in my practice directly, or just me hearing from other colleagues in the space. And so, there's a few trends that I've noticed as far as why and how this is happening. I think one, there are more frank conversations happening around physician burnout.
Mhm.
That is a huge contributor. And I think thankfully physicians are starting to take that phenomenon much more seriously for themselves, as well as kind of systemically across, their colleagues and just across healthcare in general. I think too, again, just referring back to the pandemic, that really just opened the floodgates for, not only doctors to start to really acknowledge, not only is the pandemic putting all these strains on them personally and professionally, but there was, more of a social awareness now of
Mhm.
this too, of just how much, American society takes advantage of physicians and expects them to be, strong and, to use that, that term, quote unquote, resilient,
Yeah.
and really just kind of seeing, more and more that there are cracks. And of course there are cracks. We're all human.
Yeah.
And so really just humanizing doctors in that COVID intersection has been huge. I think there's generational shifts too, as I kind of spoke to in the article. Gen Z and millennials are much more apt to have frank and open conversations about mental health. And, as we kind of, again, kind of get into the intersections of how American healthcare really beats down doctors across so many factors and, the impact that that has on their well-being. I think all of these things are, really contributing to people taking their wellness much more seriously and acknowledging that they need help too.
So when you entered that word resilient, you put it in quotes. Why did you
Yes.
do that?
Yeah, it was kind of a slight nod to one of the other articles I've written for Kevin MD, where, I essentially say we need to stop telling doctors to be resilient. And, briefly just with that, I think resilience and kind of that word, and I see it so used so often, especially in physician wellness spaces and wellness programs that are institutionalized in hospital settings or big systems. I think it really misses the mark because it individualizes what are deeply systemic things, right?
Hmm.
So telling doctors to be more resilient when these are already deeply resilient people,
Hmm.
is not only missing the mark, I think it's harmful, right? So when we're internalizing these messages of I just have to try harder, I have to be better, etc., those very things are the factors that are contributing to how burnt out and how overwhelmed and exhausted
Hmm.
and running on fumes doctors already are. And then to implicitly and explicitly have these messages, beat into doctors all the more, it's not only not helpful, it tends to make the problem worse.
Now, there are a lot of professions, of course, where burnout is prevalent. You work specifically with physicians. So, what is unique about medicine that makes burnout among physicians different from burnout in other professions?
Sure. So I think that, this is where my depth lens really comes in. So a lot of what I do with my physician clients is, rather than trying to focus on these quick fixes of like, oh, you just need to cope better, try some grounding techniques, try breathing techniques, etc. We actually deliberately put that to the side and actually get really deep into their histories. And so what I notice a lot with doctors in particular is that there's a lot of, personality and family of origin dynamics around being the helper, being the savior, being the martyr, even being very self-sacrificial. These internalized schemas of always being available for other people, often to the expense of oneself. These factors, I think, are particularly unique for physicians intersecting with, as doctors, doctors are, taught throughout their training to identify a
Hmm.
problem, get the diagnosis right, come up with a clear treatment plan. And yes, I hear, a lot from, physicians that, so much of what they have to contend with is, the gray in medicine, and how sometimes there isn't always a clear answer. But that doesn't always translate for people with being able to have a sense of gray in their personal lives and their
Hmm.
whole sense of self as well. So I think those particulars of medicine being viewed socially as well as internally as a noble profession, as a profession that's supposed to be a calling that you're supposed to give your full self to, these factors can make burnout even more entrenched, so that such that even when we name those systemic factors, we still have a lot of personal work to do to process and meaning make around these internalized schemas of identity and how they see
Hmm.
themselves. So yeah, that's just a short list. There's so much more there, but
So, give us a success story. You obviously don't have to give personal information, but amalgamation of cases where a physician went to you and you made a difference in their lives, and maybe a little bit of a before and after, just so we can see some of these techniques in action.
I think a broad arc that I see is that there's a particular pattern I've noticed of actually attendings that are 3 to 5 years out from training.
Hmm.
They've finished residency, they've finished fellowship, they're in attending life. Maybe, they're in their first job, or maybe they did their first job for a year or so, it didn't work out. Maybe they're in their second job, but around that 3 to 5 year mark post training, where they hit a wall. And so they hit a wall for a variety of reasons that I've seen. They Doctors can often have this fantasy of being in the rat race. Like, if I just get through this next step, all right, okay,
Hmm.
relief is just behind this next milestone, just on the horizon, right? So, and they have to cope that way, right? It's understandable, right? If I just get through med school, if I just get through residency, things will be better. If I just get through fellowship, relief is just around the corner. And what I often tell my clients is, wherever you go, there you are, right?
Hmm.
So the external is real, of
Hmm.
course, it's material. However, when there isn't space to work on yourself, you're going to still find yourself struggling with similar things, even when your external circumstances seemingly get better. So a broad arc that I see with clients in terms of before and after with treatment is they'll come to me, 3 to 5 years out, and they're just like, I have either replicated
Hmm.
the circumstances in my current job and in my current life that I was struggling with even when I was younger in training, like a job that is working them to the bone. They're picking up call shifts, constantly. There's kind of a deeper sense of emptiness of, they don't even know what to do them with themselves when they have free time off, etc. And now there's some awareness of like, I can't blame training. I can't
Hmm.
blame medical school. I can't blame residency. Like, this is my life now. And so they'll come to me kind of with this arc. And what we'll do over the course of therapy is process how and why they've gotten to the point that they have. And that, usually requires a lot of emotional processing around grief of milestones or younger years that they've missed out on in training, or, a lot of the narratives that they may have told themselves of, you know, things outside of me have to
Yeah.
get better, but I don't have to work on myself, or there aren't things that I have to hold myself to account to, or the opposite too. That kind of both and is a lot of what I contend with my clients of things are situational as well. So I also have, an arc of doctors where they're constantly
Hmm.
self-blaming, right? And so we have to do a lot of work to help them see the bigger picture.
Sure.
And so over the course of, therapy, we process all of those things, we meaning make around them with a deliberate focus of not trying to problem solve stuff. And over the course of time, there's various, success stories of, they might leave an oppressive job, right? They might go look for something where they might make a little bit less money, but they have much more time.
Yeah.
It may look like them working on assertiveness, where they may be, asserting themselves with hospital administration a bit more to ask for more time off, to build that into their contracts, etc. It has also looked like, us building a sense of self outside of their physician role.
Hmm.
A lot of doctors I'll see, they've either lost touch with or they don't even have hobbies, right? So even just that sense of having a personal life outside of work, actually cultivating that over time. So yeah, just a kind of broad strokes there.
Now, what kind of questions should physicians ask themselves to determine whether therapy is right for them?
Good question. So I think one thing to ask yourself is, am I ready for introspection?
Hmm.
So that can be a tough one for folks, right? There can be this knee-jerk impulse that I think broadly in society is really kind of gratified, again, looking for instant gratification, as opposed to, am I ready to do deeper work? And am I ready for change? And it's okay if the answer to that is no, we're not right now,
Hmm.
right? I'll often have conversations with potential new clients where they're really frustrated with their life and their circumstances, but they just don't feel like there's enough room and space for them
Hmm.
to really feel like they can make changes right now. And that's okay. So, are you ready for introspection? Are you looking for quick fixes versus are you looking to make more meaningful changes in your life? I think that can be a helpful question. Are you looking for more kind of coping versus, again, that deeper type of work? For coping, there's great therapy out there that's, more structured, more solutions focused. So that can help people determine, the type of approach that's going to be helpful for them. I think another one too is, am I getting feedback from other people in my life
Hmm.
that there's stuff for me to work on? So a lot of times people will reach out, not so much because they feel like they want to or need to, but there's just some sense of like, my wife or husband or spouse is telling me like, look, you got to work on yourself, or getting feedback from friends, sometimes even colleagues when things are really bad, where they might be noticing cracks showing. So are you getting feedback from important people in your life that it's time for you to, attend to yourself a bit more?
We're talking to Annia Raja. She's a clinical psychologist, and today's Kevin MD article is Why More Physicians Are Quietly Starting Therapy. Anya, let's end with some take-home messages that you want to leave with the Kevin MD audience.
Yes, I would just love to impart to people, take your sense of self and your mental wellness seriously. It's important. We need our healers to be whole in order for us to be able to help and provide healing to others. And I would say also, too, really allowing ourselves to collectively dismantle whatever stigmas might be there for doctors to reach out for help. There's a strong sense of identity that doctors understandably have of, I have to be the strong one, I have to be the one that's holding
Hmm.
everything together. And just as you advise your patients that it's okay to reach out for help, that you need to, really encouraging people to kind of bring that message back home towards yourselves. There's a lot of stigma, unfortunately, for doctors and even reaching out to get care. And you also don't have to be struggling or in acute distress to reach out. I really encourage people to think about wellness, including, something like therapy, as
Hmm.
more akin to how we would think about other wellness exercises like lifestyle, diet, going to the gym, etc. You don't just go to the gym when you have an injury, right? It's an ongoing practice of maintenance for the sake of your health. And so I invite your audience to cultivate a mindset more akin to that when it comes to attending to mental wellness.
Anya, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Absolutely. Thanks for having me.